Hey, this is Cody Zan from Body Option Clinic in Vancouver, British Columbia. And I'd like to share this special video for you to share some wisdoms and knowledge. So the topic of this video is pain isn't always what it seems. And I'd like to bring a real clinical case that I have treated over the weekend so hopefully I can bring the point home toward the end of the video. So make sure you're watching till the end. So over the weekend, there was a new patient that I've seen was a referral from an existing patient. And this person came in with a really frustrated face. And I still remember the person was really tall. He was about 6'3", lots of muscles, but the face was, I can tell he was in a lot of pain. And we sat down, we got into a consultation room, and his chief complaint was bilateral shoulder pain. So pain on both shoulders, especially the left shoulder was in pain 24/7. And he told me he has tried every single therapies in the city and still not working. So he's tried chiropractor, acupuncturist, medical doctor, physiatrist, physical therapist, massage therapist. He's tried some energy healing, and he also tried cold plunges, sauna, resting, everything that you can imagine that can bring him to full recovery, and he still failed to recover. So I can see why he's so frustrated. And I do how I normally do. I dug really deep into the case. So I asked him a lot of clinical questions relating to the shoulder pain, trauma, history of trauma, any surgeries, and none of those things show up positive. And I felt a little bit frustrated too at the beginning, but through my training, I learned to become curious. So then I asked him, how did the shoulder pain begin? And he couldn't remember how the shoulder pain began, but he did remember the shoulder pain slowly developed. And through that, I started to develop a sense of something isn't adding up. And there's no history of trauma, no surgery. He didn't overuse his shoulder at that particular time. So I did one of the rare exams that I rarely do, which is called bear hug maneuver, which is a maneuver to screen whether a patient has developed a subscapularis tendinopathy. So if you don't know what it is basically a maneuver that a medical doctor will perform or any clinician, healthcare provider will perform to rule out possible tendinitis in the subscapularis tendon. So this is how it is. So I put his left arm across his chest, and I'll be putting my hand on his palm to push against his palm to see if he's able to resist. And during this test, he wasn't able to resist, meaning he's got weakness and also that trigger pain in his shoulder, and it was positive. And what I did was, in order to confirm that's where the problem comes from, so I used a muscular ultrasound to look into his left shoulder and look into the subscapularis tendon. And I also found there's a congruence evidence that align with the subscapularis tendinopathy. And what I did there was actually quite interesting. I put a small fine acupuncture needles directly onto a tendon sheath, and I combined that with an electrostimulation machine to stimulate the tendon, to help repel fluid collections, to help repel the fluid from accumulating on a tendon sheath. So that can help the tendon to decompress. Just under 10 seconds. 10 seconds, guys. Took the needles away. We did exact same test and having to move his shoulder, and the pain was eliminated. It was gone. And he even felt there's more room in his shoulder that he hasn't felt for months. So he was extremely happy at the end of the treatment. So what's the lesson here? There's two lessons that I like to bring home. So the first one is challenge the status quo. So in the past, from his history of seeing other clinicians, therapists, and doctors, majority of them told him that he has overuse syndrome. He developed an overuse pattern in his shoulder and he needs to rest. So, and he did exactly that, but he's not getting any positive result. So, as a clinician, I always treat a patient like I have never met them before, even though the patient have seen me over many, many years. Every single visit, it's like meeting a new person. So I always keep my minds open to allow possibilities to flow in, because finding out what's actually wrong, it's an art of being open and also being curious. And the lesson number 2 here is, I would like to say, think differently. So if I buy the concept of the person has overuse syndrome, then I will probably do similar things as what his therapist has been doing, except he just more frustrated because it's probably unlikely it's going to deliver any result. And the ability of think differently does require some knowledge and courage to challenge the previous thinking and to find and rediscover. So I hope this can help bring some or expand your knowledge and help you to overcome some challenges in life. And if you're suffering from some chronic pain for many months, weeks, or however long, and after you watch this video, I encourage you to look deeper. The pain might not be where you think it is. And if you want some guidance or if you want to talk about it, make sure you leave a comment down below. And if you like this content, please like and subscribe and send to a friend and family friends of yours. And let me know how you like this video. And I'd like some feedback from you guys. So hopefully I can make more videos like this and be able to share some of my knowledge and some of my experiences. And yeah, so thank you for watching.